The iron is already in the fire. It has been there long enough to stop glowing orange and start glowing white. The surgeon, if you can call him that, wraps his hand in cloth, lifts it out, and presses it flat against the open flesh of your leg. You smell yourself before you feel it, and then you feel it, and the wound closes, not with thread, not with anything gentle, with heat, with certainty, with the oldest surgical instrument your species ever trusted. That is the thing your instincts reject before your brain even starts working. Close the wound, seal it, keep the outside out. Every reflex you were born with leans toward the needle and the suture, toward the idea that a wound shut is a wound healed. Medieval surgeons knew that reflex, they had it too, and they overrode it deliberately, not out of ignorance, but out of a specific and carefully reasoned fear. The danger was not always on the outside of the body, sometimes it was already inside, and sewing the skin shut over it was not healing, it was burial. So before you can understand why they burned, you have to understand what they were actually afraid of. Picture a battlefield in 1346. Crécy, the ground afterward, arrow wounds, sword wounds, wounds made by weapons dragged across everything filthy between one village and the next. A surgeon working in that field, and there were surgeons there, named men with texts and teachers behind them, is not working in a clean room with clean hands and clean light. He is working in the dark, in the mud, on a body that has been open to that mud for hours. Closing that wound with a needle seals the mud inside it. The heat of iron does something a needle cannot. It destroys what is already there. Visible corruption, the surgeon would say. What you and I would call infection, though neither word is the right one for 1346 because no one yet knows what infection is. What they know is what they can see. Black edges, spreading color, flesh that has already started becoming something else. And they know, from watching wound after wound, that the body that keeps bleeding does not always survive to rot. But the body that stops bleeding and then goes wrong inside almost never does. The logic underneath this is not superstition. It is pattern recognition built across centuries of watching people die in two very different sequences. Roger Fugard, writing in the late 12th century, the surgical text known as the Chirurgia, already distinguishes between wounds that should be sutured and wounds that should not. He does not recommend burning everything. He recommends reading the wound, size, location, the character of the tissue, how long it has been open, whether it is still bleeding, whether the flesh smells. Cautery is not his first answer, but it is his answer for the cases where other answers have already failed or cannot be trusted to hold. A century later, Theodoric of Curvia pushes further. He argues in the Chirurgia, written around 1267, that wounds healing without the production of pus heal faster and better. This is not a small claim for the 13th century. Almost every medical tradition around him holds that pus is a sign the body is doing its work correctly. That laudable pus, as the phrase went, means recovery is underway. Theodoric looks at the wounds that stay dry and clean and close quietly, and he concludes that the discharge is not a feature, it is a failure. So the question becomes how you get a wound to close without feeding it the material that generates rot. And one answer, not the only answer, but one answer is to destroy that material before it has time to breed. The iron does three things at once. It stops the bleeding by sealing the vessels shut through heat. It destroys the corrupted tissue at the wound's edge, the parts already going wrong. And it leaves behind a surface that is, in a very specific sense, clean. Not sterile in the modern meaning, but free of the softness and moisture that the surgeons watching wound death knew preceded the worst outcomes. What it also does, which no one in 1267 or 1346 would say out loud as a benefit, is cause enormous pain, leave permanent scarring, and fail completely in ways that suturing would not. The iron is not a perfect solution. It is a solution built for the conditions actually present when the wound is fresh and the patient is still alive, and the alternative is watching them go the other way. The texts debate this. The texts argue Arabic surgery, particularly the work of al-Zahrawi, the Andalusian physician writing in the late 10th and early 11th centuries, dedicates entire chapters to cautery instruments, their shapes, their temperatures, their applications by body part, with the same careful attention a modern manual gives to sterile technique. This was not improvisation, it was a system. But here is the question the system itself never fully resolved. if burning a wound could sometimes work better than closing it. What did that mean about the body underneath the burn? What was the surgeon actually trusting when he put the iron down and stepped back? What he was trusting was a theory of the body that held together for 14 centuries without anyone finding a reason strong enough to break it. Humoral medicine does not ask where the bacteria are, it asks where the balance went. The four humors, blood, phlegm, yellow bile, black bile, exist in a body in proportions that shift with season, temperament, diet, and injury. A wound disturbs the balance. The body's response to a wound is an attempt to correct that disturbance by expelling whatever has become corrupt. Pus, discharge, the blackening of tissue at the wound's edge. These are the body pushing corruption outward. The surgeon's job is to help it do that or to stop it from doing it in the wrong direction. Inward, downward, into the parts of the body that cannot survive the arrival of what has gone wrong. This is not a stupid framework. It is a framework built entirely from observation of real outcomes, in real bodies, over real centuries without a microscope. And it predicted something true, that sealing corruption inside a wound was more likely to kill the patient than leaving the wound open. It just explained the mechanism incorrectly. The theory was wrong about why. It was not wrong about what happened. Picture your leg again. The wound from the previous section, still open, still warm. A surgeon presses the iron in. He is not acting on instinct. He is acting on Galen, on Al-Zahrawi, on Roger Frugard, on a chain of reasoning that runs from Alexandria through Cordoba to whatever town this field sits near and has never once been cleanly disproved. He believes the iron is driving out corruption. He is wrong about the corruption in the way he means it. But the heat is doing something real. It is denaturing proteins. It is destroying microbial load at the surface. It is sealing blood vessels in a way that nothing else available in that field or that surgical tent can do as quickly or as certainly. The patient under his hands is more likely to survive the next hour than the patient whose wound was stitched shut over dirt and degraded tissue. Not always, not reliably, but enough. Enough that the system persisted, enough that the text kept recommending it. And here is where the grimness sharpens into something specific. Henri de Mondeville, the French royal surgeon writing in the early 14th century, pushes directly against the overuse of cautery in his chirurgy, begun around 1306. He does not reject it. He argues that surgeons were applying it too broadly, in cases where the wound was clean enough to close without it, where the tissue was viable and the bleeding controlled. He describes patients burned unnecessarily. He is not a gentle critic. He is a working surgeon watching colleagues reach for the iron out of habit or fear rather than judgment. And his argument that cautery has a specific application and that applying it past that application causes harm without benefit is the argument that begins to narrow the practice, not eliminate it, narrow it, because he still accepts the iron for the cases where the alternative is watching corruption spread through a body that no other intervention can reach in time. The practice sort of worked. That sentence deserves to sit still for a moment because it contains everything strange about pre-modern medicine. Cautery controlled hemorrhage in a way that ligature often failed to match under field conditions. It reduced some contamination at the wound surface. It left a wound open rather than sealed over materials that would have generated exactly the outcome the surgeon feared. It also caused shock. It also scarred. It also failed in cases where a clean suture and rest would have succeeded. The iron was not a good answer. It was the least bad answer constructed from the information available. Applied by people who were trying to read the wound the way a tracker reads a trail, not guessing, but interpreting signs they had learned to trust across decades of watching bodies go one way or the other. What it says about pain is something else entirely. A patient in that tent, on that field, under that iron, is experiencing something your nervous system would identify immediately as catastrophic. And the surgeon pressing it down is doing so in the belief that this is preferable to the alternative. Not because pain means nothing, because death means more. The calculus was not callous. It was the only calculus available. In a world without germ theory, without antiseptic, without the knowledge that a wound can be made clean rather than merely burned past cleanliness, the iron stood between the surgeon and helplessness. It was a way to act, to intervene, to do something to the wound that felt controlled rather than passive. And that feeling of control was not entirely wrong. It was just incomplete. The body you carry into this moment was shaped by the people who survived those interventions and by the surgeons who kept refining the question. Not when should we burn, exactly, but when should we not? That refinement, slow as it was, is what eventually becomes a surgery that would recognize what the iron was actually doing at the cellular level and replace it, one instrument at a time, with something that achieved the same ends with less destruction. But the iron came first. For 14 centuries, it came first. And it came first not because the people holding it were ignorant of pain or careless with life, but because they were reading the body as carefully as they could with the tools observation alone provides. And the iron was the most honest answer the evidence supported. The wound closes. That is what the iron does in the end. It closes the wound on its own terms, through damage rather than repair, through certainty rather than gentleness. And in the conditions it was built for, a body open to the world, bleeding, already contaminated, hours from anything better. That was sometimes enough. If this is the first time you have looked at a historical medical practice and seen something other than cruelty or superstition, it will not be the last. The history of surgery is the history of people trying to keep a body alive with whatever the evidence they had would support. That evidence kept changing. The trying never stopped.